friends, presenting you another interesting case study of the most common scenario, grade 2A, hairline recession and vertex baldness. So here it goes. So our patient presented to us with a receding hairline, which you can call between grade 2 and grade 3. So we plan to cover his front, which is this area, and also he had a reasonable hair loss on his vertex, which he was very concerned about. So along with the hairline, this vertex patch also needed to be covered. So we did a hair transplant for him using around 4200 grafts, where we use around 2200 grafts on the hairline and roughly 2000 grafts on the vertex to save the middle area medical treatment. So this is a picture of the hairline area where we have done the picture showing the pattern of slit making. Now if you see here closely, let's say this area. So the slit making is the most important part of your hair transplant and should always be done by your surgeon. Now what we do in slit making is there are two kinds of slits, horizontal slits and vertical slits. Both have their own pros and cons. We don't have any particular preference. In this case, I am presenting it with vertical slits. Now, what is important in these slits? Number one is density. So, the hairline is usually the high density area where we want to give a density between 35 to 40 grafts per square centimeter. We can go up to 50 also, but that we usually do only in people who are grade 2, who are not losing hair further, like traction alopecia. And because we know that we are not going to need any further hair transplant, we don't need to save the donor area for future, then we go up to 50. But when we have male pattern hair loss, dynamic hair loss, future hair loss also has to be taken into consideration. So we want to judiciously use the donor area, and that is by 35 to 40. So density. Second is depth. So the depth of the slit is very important. The depth has to match the length of the hair follicle. So usually we take out a couple of hair before making the slit so that we know what depth we want to go to, and the orientation of the slits as respect to each other. Now if you see this area closely, a slit here is not immediately followed by a slit at the back. The other slits come on the sides of it so that there is no see-through. I'll explain my point here. So let's say we make slits like this. We don't want to make the second row like this. Otherwise there will be see-through. What we want to do is brick ring. So the gap of the first row is covered by a graft on the second row so that there is no see-through. So that is what we follow. We have special instruments to make sure that there is brick ring done when there is slit making. This is how it looks after completion of the procedure. These white dots are the grafts. Coverage of the vertex area with a density slightly lesser than the front. So on the front it is 35 to 40, on the vertex it is 25 to 30 grafts per square centimeter. This is the donor area. It has to be extracted in a way that you don't take out the hair follicles too close to each other. So for every follicle that is taken out, few follicles are left on the sides, above and below, so that this patch gets well covered after 50 to 20 days. So this is how it looks after 7 months. The hairline has formed. The vertex area, which had a bald patch, has started to getting covered now. There's a close-up view of the hairline. Now, if you don't know that this person had baldness before, it's very difficult to tell that something has been done, and that is what we call a natural looking hairline. It can never be 100% natural. If you know about hair transplant, if you see it very closely, you will be able to tell. But by and large, what we say, it is 90% natural. Smart zigzagging, correct use of singles, correct use of multi-head grafts to give a nice and natural look to your hairline. The vertex area. So this was the bald patch. This was the bald patch where we use around 2000 grafts. You see it's well covered. The whirl is maintained. It is not just front and down. A proper oval is maintained so that it looks nice. So pre-post comparison at 7 months, hairline area before hair transplant and after hair transplant. So looking nice, well covered. Vertex area, pardon me for the different angles of the picture, but that's what it is. So this bald patch here has been well covered. Thank you very much for your patient viewing, and if you have any further suggestions, comments, please let us know and we'll try to make our videos even better. Thank you so much.